Good morning, everyone. I'm Diana Saylor. And this morning, Rachel and I want to start off with our background and a fun fact. So for those of you that don't know, I joined the firm in July of 2000, right after I graduated high school. And I worked full-time, attended college, and I thought I wanted to pursue psychology. But then I quickly realized after sitting in meetings with Carrie that I was really intrigued with the psychology around money. And so 22 years later, I'm still intrigued, and I love helping you guys and hearing your stories and helping you live your best life. And a fun fact about me is that my family and I love to camp, and we're part of a local Airstream club.
Thanks. Hi, everyone. I'm Rachel Bubb. I am a wealth manager here at KWB Wealth as well. And I started about 4.5 years ago. Before this, I was farming on Bainbridge Island in Washington. And I had a whole vision of creating a career in sustainable agriculture, sustainable business. After 1.5 years of farming, I decided I wanted to do something a little bit different, try a desk job, and I had the opportunity to come work here. And quickly, within 6 months, I really fell in love with financial planning. And what really sold it for me was just hearing the client success stories of working with them from, wherever they were in their stage of their life to retirement, and then all the way through to the end, and just the gratification and just how happy they were to be able to have someone on their team to help them do all the things that they wanted to be able to do. So that's what kept me in it. And since then I got my securities license, and I'm a CFP, and I'm continuing on the journey. It's really great to be here. And a fun fact about me is I still farm. So my husband and I started our own little farm in Redlands on our property, but we sell to our local neighbors. So we had about 7 to 8 people in what we called our CSA. And that was really fun. We got a lot of great reviews on our tomatoes. So, and so today we're here today to talk to you guys about financial planning and Medicare, because Medicare is a part of financial planning. And there's so many things that our clients want to know, and people just in general, about Medicare. Diana and I learned a lot about Medicare, and we're excited to share it with you guys because it's just good to know. And hopefully at the end of this, you'll feel prepared to enroll or wherever you're at in that journey. So I'll pass it back to Diana and we'll get started.
Great. Thank you, Rachel. Before we get into the basics of Medicare, we wanted to provide you all with a little bit of a history lesson. So, the concept of a national healthcare program is actually over 100 years old. This isn't new. And so really the need is that, most Americans after retirement, they didn't have healthcare coverage. And so finally in 1965, President Johnson adopted Medicare. And original Medicare, what that consisted of is, which it still does, Part A and B, but it only was able to provide for individuals over age 65. So those were the only individuals that were eligible at that time. But since then, there have been some major changes to Medicare, and so we wanted to just go over a few milestones. So from 1972 to 1990, individuals under age 65 that are disabled and or have kidney disease are eligible. Hospice care was added, sliding scale premiums, standardization of Medigap was also added during that time frame. And then from 1999 to 2010, Medicare Part C, or otherwise known as Advantage plans, were added. They're offered through private insurance. Medicare Part D coverage was added, and also preventative care. So let's get into the basics. We'll start with Medicare Part A. What does that cover? It covers inpatient care in hospitals, short-term skilled nursing facilities, hospice care, and home health care. It does not cover private rooms and long-term hospital stays of over 25 days. Medicare Part A, the premiums are usually free as long as you have paid Medicare taxes for at least 10 years and you have to be over age 65, like I mentioned, or under age 65 and disabled and or have kidney disease. The deductible for Medicare Part A for this year is $1,556 for each benefit period, which is up to the 60th day. From days 61 through 90, there is a daily coinsurance amount of $389. And if you find that you need additional coverage after the 90th day, they do allow you to utilize what they call your lifetime reserve days. So it's 60 additional days. They're non-renewable, but you're going to pay a daily coinsurance amount of $778. Medicare Part B. What that covers is doctor's costs, outpatient care, equipment, and other medically necessary services. It covers preventative services like lab tests, preventative screenings, yearly exams, and vaccines. It does not cover dental care, cosmetic surgery, eye exams, hearing aids, or prescription drug coverage. The premiums for Medicare Part B for this year, $170.10 a month, and that premium may differ just depending on what your income tax bracket is. So for example, if you're married filing joint and your income is over $182,000, then your monthly premium is $238.10. And what Medicare does is they have a 2-year look back. So whatever your income was 2 years ago, that's how they're going to base your premiums. And so there are certain instances where you may need to communicate with Medicare if there's something going on in your life where your income may change, and they call those life-changing events. And there's only certain examples that qualify. So maybe you got married or divorced, or maybe your spouse passed, unfortunately, or maybe you're retiring. And so those are instances that you can let Medicare know by filling out this form that we've referenced to let them know that there's going to be an income adjustment. Now, there may be years where maybe you sell a piece of property or you sell investments, or maybe we've helped you with a Roth conversion or something like that. Unfortunately, those do not, they're not categorized as a life-changing event, even though the tax liability might seem or feel like a life-changing event, it doesn't qualify. So we should have this form at our fingertips if any of you ever need to utilize that. The premium for Medicare Part B, if you're already enrolled in Social Security, it's going to be automatically deducted from your Social Security payment. If you enroll in Medicare prior to receiving Social Security, they will mail you your bill monthly. The deductible for Medicare Part B this year is $233 for the entire year. Once that's met, then Medicare will cover 80% of your expenses. Medicare Part D, this is the optional prescription drug plan offered through private insurance carriers. And the deductible for Medicare Part D, it's really based on whatever the insurance carrier determines that it will be, but there is a standard deductible that's set by Medicare. It can't be more than this, and that's $480 for the year. And insurance companies, when they price medications, they usually do it based on a tiered program, and it's usually about 5 tiers. But medications, they're changing all the time, and the costs associated are changing all the time. So that's something to keep in mind. Now, there currently is no out-of-pocket maximum for Medicare Part D, but fortunately, this year in August, the Inflation Reduction Act was passed, and it will allow for a cap in 2025 of $2,000 for the year, and that includes your deductible. And so I'm going to pass it over to Rachel. She's going to talk about supplemental and Medicare Advantage.
Thanks, Diana. Okay, so Medicare Advantage, that's often referred to as Part C, and that includes your Part D. And then there's supplemental Medicare, and this is also known as Medigap. To be able to enroll in either of these each additional Medicare programs, you need to have already been enrolled in original Medicare that Diane had mentioned, Parts A and B. So first we're going to talk about Medicare Advantage. So Medicare Advantage, like I mentioned, is known as Part C, and this is the alternative to Medicare in Medicare A and B coverage, and includes your Part D typically. So it's basically wrapping everything into one called Part C. It's provided by private health insurers. So you go out into the marketplace and you find the private insurance company that meets all of your needs. And I'll talk more about what that looks like. But these private health insurers do have to follow rules set by Medicare. So it is regulated to make sure that they are meeting the original Medicare A and B protocols and everything. The reason people get Medicare Advantage or an additional like Medigap as well is it's to help reduce out-of-pocket costs. So like Diana had mentioned, parts A and B don't have a max out-of-pocket. Well, Medicare Advantage comes in and they do set that max out-of-pocket. Medicare Advantage is also guaranteed renewable. So automatically you'll be re-enrolled annually in your contract if you continue that premium payment. And we'll talk about if you really want to do that, or if there's, it's always good just to do a checkup before you re-enroll every year. And then check up on your Medicare plan. So how it works. You go out into the market and you choose an insurance provider that includes your current healthcare providers in your region and service of area, if that's important to you. So it's similar to what we have now with the HMO, right? Where you have to have your primary care provider and you stay within your network for healthcare. Medicare Advantage is flexible in that you can have the HMO or the PPO. The PPO will cover your in-network and out-of-network services with a higher cost sharing. But the key thing about Medicare Advantage is that there is a network that you have to stick to. So Diana, could you please share that story about our client that learned this when she was experiencing some health concerns?
Yes, so we had a client, she needed to be admitted to Kaiser Hospital, and after her care, she recovered, but needed additional care in an outpatient skilled nursing facility. And so she has a long-term care policy with a previous employer and thought, well, I have this long-term care insurance. I can go to any outpatient care facility that I want. Maybe I'll go to Redlands or somewhere that's closer to my family and I. But soon learned that under the Kaiser network that there were only 2 options for her to have this care. So it's very important to just figure out what the nuances are in your specific network.
Yes, thanks, Diana. That's it's really important because you are choosing that network, so you want to make sure that you get the right one. All right. So Medicare Advantage, it does cover your Part D, that prescription drug plan. It also includes dental, vision. Some plans have additional incentives like a gym discount, and then they also have medical transportation reimbursement. So by going to a private insurer and paying an extra premium, they're trying to incentivize more offerings for you. So the cost of Medicare Advantage is similar to, well, first, you're going to always be paying that Part B premium. So that's always going to happen. That's going to be deducted through Social Security. And then in addition to that, each plan is going to charge a monthly premium. So if you remember on the poll questions, one of them was, what was the average premium for Medicare Advantage in 2022? And that was actually $19 a month. So I don't know, we'll see who got that one right and who got it wrong. Now, I want you to take this with a grain of salt because we have had clients come back and tell us that the premiums are actually much higher. So this is a number that's national, and California, if you're here, the insurance cost might be a little bit higher. So just take that with a grain of salt, and it's going to be different for every person depending on your needs. You will still have to do co-payments for in-plan providers and out-of-plan providers. However, generally, Medicare Advantage is great because it has low or no monthly premiums with cost sharing, and it has that annual max out-of-pocket cost. So this is really why people want to have a Medicare Advantage plan. And for 2023, the max out-of-pocket cost for in-network services, so that HMO system, is $8,300. If you're doing a PPO plan with in and out-of-network, you will have a max out-of-pocket of $12,450. Once you hit these out-of-pocket limits, that applies to your Part A and B services only. So you will no longer owe any co-insurance on Parts A and B services. This max out-of-pocket does not apply to Part D. There's actually a separate threshold for that, and that's $7,050. After that, enrollees are required to pay 5% of the cost. Now, this is changing a little bit with the new bill that came into place, the Inflation Reduction Act. I think it was only like certain medications were also covered. So again, just something to know that there's a little bit of nuances for each of these. And the last thing is that the plan costs will change annually, or is more likely to, with Medicare Advantage. So before you re-sign your contract, we encourage you just to look at it and make sure that the premiums are still feasible to you or accessible. And then if you need to reevaluate your situation, we have a great tool to help you do that. So in summary, the great thing about Medicare Advantage is that there's low to none monthly premiums. There is that max out-of-pocket cost, and then you get some additional benefits like the gym discounts. The disadvantages is that it is an annual contract. So the cost structure can change annually, and you just need to be aware of that before you re-sign on. There also could be higher cost sharing, right? If you're going to do the PPO. There are those network limitations, and you can't keep your current Medicare Advantage and Part D plan. So if you've already enrolled in Parts A and B, and then in addition to that, you picked a Part D prescription drug plan that you really like, if you want to go and get a Part C, which encompasses all of that, you're likely going to have to drop your Part D plan, your prescription drug plan, to get the Medicare Advantage. So that's just something to be aware of. All right, then there's Medigap. So Medigap is known as the Medicare Supplement Plan. This is also sold by private companies, and it helps pay healthcare costs. Original Medicare does not, with that max annual out-of-pocket cost. So this is an addition to your Parts A and B. You're going to keep original Medicare. You're going to have your Medicare, your Medigap supplemental plan, and then that's going to set the max out-of-pocket cost for you. And then in addition to that, you will need a Part D because Medigap does not have that. The great thing about Medigap is there's more freedom of access. There are no networks. If a doctor takes Medicare, they will take Medigap. So it's similar to Medicare Advantage, where you're going to be continuing to pay that Part B premium through Social Security, that $170 a month. That'll continue to happen. And then in addition to that, you're going to pay a monthly premium for the Medigap policy. The great thing about Medigap, like I mentioned, is you don't have a provider network. You can really go anywhere as long as the doctor takes Medicare. And it is guaranteed renewable. It will automatically renew each year if you keep paying that premium. They don't typically change their costs as much as Medicare Advantage does, is what I gathered. The costs for Medicare are higher premiums than Medicare, and there's fewer out-of-pocket costs. We do set that max. However, just in general, the lower the monthly premium that you want, the more out-of-pocket expenses you have to pay before your insurance begins to cover your bills. So when you're going out to decide, I guess, a premium amount, think about how often you plan on seeing the doctor. So if you do have some sort of medical condition that requires you to go to the doctor 2 to 3 times a month, you might want to pay the higher premium to reduce that cost sharing. So those are just some of the things to start thinking about. Medigap does not include Part D, like I mentioned, so you will have basically 3 separate plans. You're going to have original Medicare, A and B, Medigap, that supplemental plan that helps with max out-of-pocket costs and reduce some of the spending, and then your Part D. The great thing about Medigap, though, is that it works in any state, and some plans actually cover internationally. What it does not cover is usually dental and vision, so that is something that if it is important to you, you want to consider that. Some plans do cover dental and vision, or at least have some discounts, so you can find them. In summary, the great thing about Medigap, it is national and international coverage, so there's more freedom of access. Just a reminder, if the doctor takes Medicare, they will take Medigap. The disadvantage is you will be paying higher premiums, and it doesn't include your Part D. At the end of the day, we all want to know which one's right for me, right? So when you're deciding between Medicare and Medigap or Medicare Advantage, how do you make that decision? The primary question you should ask yourself is, where do I plan to be? What is my retirement look like, or 65 and beyond, what am I doing? If you're planning to be an expat and you want to spend, 6 months in California and 6 months in Costa Rica, then you're likely going to want to look at the Medigap plan. That way you have coverage in both areas. Also look at Costa Rica's, their health plan, because that could also influence your decision as well. But if you're going to be more of the United States expat and you want to do a snowbird type thing, you're going to live 6 months in one area and 6 months in the other. Again, Medigap might be that solution for you because you want to be covered in both areas. The other thing to consider is the doctors. So if there are certain doctors that are important to you or specialists that you want to keep seeing, you need to make sure that if you're going to go through the Medicare Advantage route, that they're actually covered or offered within your network. If you choose the Medigap, you want to make sure that those doctors accept Medicare. So again, when deciding, think about where you'll be. And if you want to have more freedom of access, then that would be good then you'd likely want the original Medicare and Medigap. If you're planning to stick around more in your region, then, Medicare Advantage is probably the best plan. It's limited to your plan's network. You are going to have lower premiums. And, insurance, just to be aware, like they are going to adjust the cost every year. So that is something else to consider. All right, so Diane, I'll talk about enrollment.
Yes, thanks, Rachel. So if you're new to Medicare, the initial enrollment period is 3 months before your 65th birthday and 3 months after your 65th birthday. So it's that window. The general enrollment period, that's if you miss the initial enrollment period, and that's from January 1st through March 31st. And for those of you that are still working, there is a special enrollment period, and that is when your employer coverage ends, then you have 8 months to enroll in Medicare. And if you are already receiving Social Security benefits, you're going to automatically be enrolled in both Medicare Parts A and B when you turn 65. And how you enroll is actually through Social Security Administration. And so the reason why that is that the SSA manages some of the eligibility for Medicare. They basically verify that you've paid Medicare taxes long enough to get Part A for free. And then they also handle applications to join Medicare Part B.
Okay, and then there's enrollment for Medicare Advantage and Medigap. So like I had mentioned earlier, you do need to have original Medicare before you can enroll into one of these other plans. So that's the A and B. Then after that, you can enroll into Medicare Advantage during any annual open enrollment. So that's January 1st through March 31st. There's an additional annual enrollment period that's October 15th to 12/7. Be cautious that if you want to switch your plan for Medicare Advantage, you have to go through the whole year. So you've signed up for that annual contract, you have to fulfill the contract, and then you can switch your plan. Medigap, you can purchase during open enrollment. So within that 6 months after turning 65, and you've already enrolled in Parts A and B. The great thing about enrolling during this period is you don't have to do any sort of health screening. So they waive that during those first 6 months. After that, there is a likelihood that you might have to do some health screening.
Thank you, Rachel. Now we want to talk about resources. We always like to provide resources. And first, of course, we want to be your resource. So if you have a question or during your portfolio review, if you want to talk about Medicare or what have you, we want to be your resource. And also Health Pilot, Rachel's going to get into that in just a second. Some great websites that we found, of course, Medicare.gov, lots of information there. Social Security, SSA.gov under their benefits section, and Medicare, there's a lot of good information there. And then lastly, AARP.
Okay, so Health Pilot is something new that we've started working with and using. And it's actually been a pretty great resource because it's like a policy genius, right? When you go to get your life insurance. So you go into this plan, you type in your information, and that's going to include your address, your date of birth, so some of that private information, and then the doctors that you want to keep seeing and the prescriptions that you're taking. So it aggregates all of that data to go back into the marketplace and find insurance plans within your area, or maybe it's Medigap, but just like whatever it is that's important to you, it finds those providers and gives you an explanation of the benefits offered and the premium. So that gives you an idea of okay, how much can I anticipate spending a month for my, my Medicare Advantage plan? Which one makes the most sense for me? So this is a great tool that you can use at least to explore the marketplace a little bit. And we've really enjoyed it because it is an unbiased system. They have an algorithm that really is working just to find the best policies for you. Doesn't take any form of compensation into it. Really, it's again, just a database to help you get that plan. So we will have this available on our website, and we recommend that you do it on your own. Of course, we're here to answer any questions if you have it, but there is some personal information that we want to keep that private to you, like the prescriptions and some of your healthcare concerns. Of course, we're happy to help, but we also want to honor your privacy. So we recommend doing that. And it's also a great place to every year come back through and make sure that you have the best Medicare Advantage or Medigap plan. So you can type in what you have and then compare it to other plans in the marketplace. So again, great tool that we highly encourage you to use and will be on our system and available for you. And if you're interested in doing it during a review, we can also do it then as well. With that, here's our information. Most of you all know us, but here's our information to get a hold of us. And we'll wrap this up with the poll questions and any questions from the audience. So let's see how many people got okay. So the first question, what was the average monthly premium for Medicare in 2022? So a majority of people thought it was the higher amount. Oh yeah, so like there's a split between 547 a month, between 96 a month. And then, yeah, not a lot of people got the 14 or the 19 a month, which I would not have guessed that either, except I did the research.
Yeah, seems pretty low.
Yeah. And then the last one, according to a 2019 study, what is the average annual out-of-pocket cost for Medicare? So this one, we got most people around the 2,223. Dana, do you remember what the correct answer was?
It's actually more than $5,000 in a year. That's the first.
Yeah. Yeah. So again, that's why a lot of people, well, it's like, I guess the max out of pocket right now for Medicare Advantage is still pretty high, $8,300 if you're doing the in-network. But again, it is a sense of relief to be able to know that there is a max out of pocket as opposed to with original where you're like, it could all be on me. So. All right, Quentin, do you want to help us with some of the questions?
Yeah, so we have a couple questions. First here, do large companies like Edison have a Medicap or Medicare Advantage supplement insurance?
That's a good question. So I know Edison with the retiree medical, there is some co-insurance there, but I don't know exactly what the advantage or the supplemental insurance is. That's a very, very good question. We will look into that.
Yeah, we can respond to that later.
Yeah, absolutely. And we know who sent the question, so we'll respond to you.
How do these Medicare Advantage plans claim to provide their service with no premium costs?
Yeah, so I think some of them are going to be pretty low because if you have really low benefits. So if you, again, when you go into the marketplace, right, you're deciding what benefits are important to you. So maybe all you want is just that security blanket of a max out of pocket. You don't care about dental vision. You don't care about, you'll pay whatever it takes. You just want to have that security. So I think that's where they can go in and create a low to no premium cost for you. I also think it's insurance is like all about the risk, right? So if some people are more risk, then they have to fill the pool in with so it goes back to, I would say, also the plan and the insurance provider, because if they have a riskier pool, they're going to want more people to pay that higher premium to help with the cost sharing.
How does Medicare Medigap compare with Covered California?
So two separate things here. So I think you can be enrolled in both, but so Medicare is going to be age 65 and over. So I don't know if this person is under age 65, but we can look at the comparison and send that to you.
Does Medicare review your income for the past 2 years every year, or just at the first year you enroll?
Every year. Yep. So that's why you have to be, and that's why we talk about it in the planning too. So when we look at your income or we do a tax analysis for you guys or Roth conversions, Mike actually put that on the tax worksheet. So we try to be very conscious of the Medicare premium because it can happen anytime.
Final question here. I'm retiring soon and moving out of state. I'll need to apply for Medicare. Any suggestions?
Yeah, so there's definitely, again, I think Health Pilot would be a great tool for you to use, and we can follow up with you individually to get that to you, because you can type in wherever you're moving to and it'll find an insurance plan within that network. So the suggestion would be is, yeah, you'll have to find a plan that's within your area, and it would just be reaching out to even some Medicare advocates they have out there available too. We can follow up with you depending on what state you're moving to.
Yeah, and just remember you have 8 months from when your employer coverage ends. So, just wherever you're intending to move, you would want to look at whatever the local network is out there. And like Rachel said, you could utilize Health Pilot or us, and we could help you figure out what your options are in the area.
Yeah, because that's true too. You're moving to a new state unless you don't know. If you don't know any of the Medicare providers out there, and if that's unimportant to you, then you'll have more options probably. But if you haven't done any of that research, then yeah. So those are some things to think about if you really care about the doctors, if you need to see certain specialists, and then we can help you figure out how to put that into a system to get the plan that works for you. Yeah.
All right, and final question here. Is there any out-of-pocket money with the Medigap plan?
Yeah, so you're still going to be required to do some cost sharing. So that's the co-insurance or the co-pays. So when you do go to see other providers, you'll have monthly premium and then some co-pays. Now, every plan's a little bit different. And if you care about a lower premium, then you're going to have higher cost sharing, right? You're going to have to pay more for every visit. If you care about a lower copay, then you'll pay a higher premium.
Great. Those are all the questions we have.
Okay. Thank you so much, everybody. And if anything comes up for you later, please feel free to send us an email to invest@kwbwealth.com. And, or you can even fill out something on our website or reach out to your advisor here. Thank you and have a great day. And this will be available for you to rewatch if you missed anything.
Thank you all.